Okay, great. I can hear me. Well, thank you so much for having me again. I've been here a couple times making some presentations so that you can learn, obviously, get information about psychology and a bit of therapy and what you can expect, especially when you yourself are experiencing something called mental illnesses. Just as is true with any physical illness, also with mental illness, the earlier detection is the key, right? So if you, during this presentation even, if there are any symptoms that you're kind of feeling like I'm experiencing a lot more of that, I want to invite you to talk to each other about it, talk to your leaders about it. Also feel free to talk to me as well. I totally forgot to bring any business cards, so there's no way for you to contact me. But I will definitely leave my contact information to Simon and other leaders, so you can get in touch with me that way, okay? Also, too, you have three different handouts. So the way this session is going to be formatted is I'm going to talk as much as I can, and then I'm going to stop, because I don't really like to talk. My job is to listen to people. That's what I'm really good at, right? So what we're going to do is I'm going to talk for about 35 minutes, 30 to 35 minutes, and then on this topic of trauma as well as depression. And then I'm going to ask you guys to break into your small groups and talk with each other for about additional 20 to 30 minutes about your own experience of what depression has looked like for you. You guys have been in, through the school system, you have experienced a lot, you have seen a lot. Talk to each other as openly and as freely as you can, with all due respect to your level of comfort, of course, because one of the things that is really inhibiting for a person who might be experiencing these symptoms of depression or any other mental illness is isolation. If they close up and if they isolate, then it's only going to exacerbate those symptoms, meaning it's only going to get worse. And we obviously don't want that. One of the only ways to get better and to feel better and really move forward is to talk to somebody, okay? So I really would like for you to, I assume you have known each other for a long time, you know each other pretty well as friends, so feel free to really discuss what's in the handout, okay? And then we'll meet back here, not over yet. We'll meet back here. I'll present the rest of the material that we're going to be discussing. And then again, I'll break you up into small groups, and then you can discuss. And then we can meet back here, and we can close up. Does it make sense? Okay. So as the logistics about where to go and who to meet with, I'm going to leave that up to Simon to direct you. Okay. So what I'm going to do is just start the presentation. If you have any questions while I'm talking, please feel free to just raise your hand and ask. This is going to be a collaboration between you and myself, all of you and myself, to talk about what this thing called mental illness looks like and what your experience has been and any questions you might have, okay? So feel free to just ask any questions. So I have titled my talk as Trauma-Informed Therapy, Care of Depression and Anxiety. And the reason Simon, when he contacted me, he asked me if I could do a presentation on depression and anxiety. And I also talked to him about, I cannot do that without talking first about trauma. Because what depression and anxiety is it's a symptom. For an example, when you come down with the flu or with a really bad cold or something like that, you're going to have symptoms. Obviously, you're going to have a sore throat. That's usually how it starts, right? And then you get congested, and then you start coughing, and then you start to run a fever. These are all symptoms that indicate you have a cold. You should probably go see a doctor, or at least take some NyQuil or something like that. Depression and anxiety is a symptom, okay? It's not an illness in and of itself. A person doesn't all of a sudden have depression. It's usually a result of something else, and we call this trauma. Trauma can be anything between your own experiences and also what's happening in your environment, okay? So I want you to think in terms of what has happened to you personally, and then think about the environment that you grew up in, and even the environment that you're in now. and how it's impacting you, okay? Because there are events that is considered very traumatic, but a person might not consider it, or they might not even feel it, okay? Which is a concern. So I want you guys to really think about what you have been through and how you have dealt with it, how you have responded to it, and see if any of what I'm talking about resonates with some of your feelings, okay? If those feelings indicate as symptoms of depression or anxiety disorder, I really want to strongly encourage you to please come and talk to me or talk to your leader so that I know how to get in touch with you. Make sense? Any questions so far? Okay. So let's talk a little bit about trauma. Has anybody heard of the acronym PTSD? More than ever before, people talk about PTSD. You hear on the media, you hear people talking about it, particularly when our military personnel come back. Everybody talks about, okay, who's got PTSD? How do we treat it? PTSD stands for post-traumatic stress syndrome, and it basically happens when a person gets into a situation or events that are absolutely unsafe, and you don't know how to respond to it in an appropriate manner. So what happens is something called autonomic nervous system in our bodies, which is a normal, God-given nervous system to protect ourselves. What we do is we go into a fight or flight mode. And then there's also a third level that I forgot to put in my presentation. There's also something called freeze mode, okay? So people either fight or flight or freeze, all as a way to protect themselves. Anytime a person is experiencing something called post-traumatic stress disorder because they've already experienced the trauma, but they didn't know what to do with it, so they either fought it, or they flew from it, or they froze in front of it, they now experience something called PTSD many days later. It can be days, it can be weeks, it can be months, or it can be years. But it happens where they experience PTSD syndrome, okay? So usually it's extreme stress and fear and danger in normal healthy conditions. So a person who is exhibiting symptoms of PTSD, they don't have to be in a dangerous situation in order to experience the symptoms. They can be in a very normal situation, just like you are. We're inside of a church. We are surrounded by walls. We are very safe. You're sitting in a very comfortable seat, but you can experience a symptom of PTSD, okay? So why PTSD? Obviously, as I said before, there is a very strong urge for physical and emotional harm, okay? It either happens to you personally, or it happens to a loved one that you really care about, or you actually witness harm being done to a loved one. That can all induce symptoms of PTSD. Does that make sense? So just for a very obvious example, when somebody goes to war and they come back, obviously they've seen a lot of things that they wouldn't normally see here at home, right? A lot of times when different military personnel, the younger they are, the more likely they're liable to develop PTSD symptoms, because they don't know how to take flight, they don't know how to fight, and they don't know how to freeze. So what happens is there is an emotional shutdown that happens. And when this emotional shutdown happens, everything gets internalized. And so when everything, including the, what must have been a horrible event that they witnessed overseas, when that gets internalized, they start experiencing all of them, even when they're in a very safe place. And that's an indication that they have PTSD, okay? So again, as I said, very traumatic events. And most of you have not experienced any of this, which is good. But some of them are things like war, rape, or being kidnapped, mugging, torture, car accidents, plane accidents, natural disasters, bombing, train wrecks. Again, it's just pretty extraordinary events that a person has to go through in order to experience something called PTSD. However, trauma can also result from something called unsafe childhood. And this is what I kind of want to focus on, so that hopefully everybody can understand, everybody can relate to it, so that your visit here is purposeful. Okay. So unsafe childhood. When it comes to the fact, I wanted to be mindful of the fact that most everybody here is second generation Korean Americans. So likely you were born into a Korean home. To first generation, possibly, most likely immigrant parents. And so there is a lot of acculturation issues that you experienced that you might not be aware of. But I want to kind of bring them up for you to consider, especially if you've ever considered, if you've ever experienced symptoms of depression or even anxiety, and how your childhood experiences might be causing them. Okay? All right. So some of the more terrible and kind of absolutely undesired experiences of some people during their childhood are something like this. We have severe physical abuse, we have severe sexual abuse, we have emotional and psychological abuse, and neglect. Okay? So when a child experiences any of this growing up, and the younger they are, the more impactful these experiences are. Okay? Because what happens is the brain is not yet developed. Right? So when a child is experiencing, for example, physical abuse, the brain, we call it the locking up syndrome, where the brain actually freezes. Okay? So the brain is supposed to be always in action. That's how it develops, and because we're always learning things, right? When a baby is born, he or she is constantly stimulated by the environmental stimuli, and so that's why they have to take naps. Because babies get exhausted just by their sensory stimulation. What happens when a child is abused? They get hyper-stimulated. It's too stimulating. And so what the child has to do is he has to fight, flight, or freeze. And a lot of times, obviously because the child doesn't have any skills to fight or flight, they freeze. And when this locking up syndrome happens in the brain, PTSD sets in, okay? Because the child, whether it be an infant or a toddler or a child, he or she does not have any coping skills to know what to do in the situation while being abused, to literally stand up for themselves, to push back and say, "You can't do this to me." They don't know how to do that, so they have to endure the punishment, endure the abuse, and then try to forget about it. The thing is, even though the child might think that he or she has forgotten about it and is able to move on, they can't forget about it, okay? So the PTSD symptoms come up where a child could be sitting in a classroom and he or she is doing nothing. They're just frozen. I don't know if you've ever seen that, but it's a very, very sad thing to witness, where they kind of are somewhere else. They're not really there. They might be holding a pencil, but they're not writing. They're just kind of frozen in that position because they're experiencing the abuse in their minds, okay? And when that happens to a child, we know for sure that the child is experiencing PTSD. So you don't have to have gone to a war. You don't have to have gone through a car accident to experience something called PTSD. Especially when we're talking about abuse or trauma that happened during childhood, it's much more difficult to assess a person and find out what the traumas are, because for the younger the trauma was experienced, the more normal it becomes for the kid. So when it becomes normal, they don't consider it trauma. They don't consider it, there's something wrong with this. So they end up accepting abnormal to be normal, okay? So something to keep in mind, if you've experienced none of these abuses, that's great. But if you can think in terms of, I've had some of this, then please, by all means, let's talk about it and try to help you to move through it so that you can move forward. Because again, this can keep you stuck in the same place emotionally and psychologically for a long time. And we wouldn't want that for anybody, okay? Does anybody have any questions right now? Okay. So the last thing I wanted to mention in light of the PTSD as a result of abuse is something called limbic system therapy. So this is one type of therapy that we use for people who have been through severe abuse, because the limbic system is a part of the brain we call the emotional brain that is basically the center of filtering and processing and interpreting a lot of different emotions that we feel. You know, when you talk to a kid and the kid is crying and is throwing a temper tantrum and he's literally throwing himself down on the ground, and you ask, "What's going on? What's wrong?" "I don't know." "Well, you're crying and you're clearly upset. What happened?" "I don't know." Okay. At that point in time, his limbic system literally is not working. It's not the kid is giving you a hard time. It's not that the kid is, basically throwing a temper tantrum because he wants to have a temper tantrum. It's because his limbic system is locked up. He's way too stimulated. There's something called hyperarousal, where something called cortisol, which is the stress hormone that you might have heard of, it is flooding the brain because the kid is overly stimulated by something, either by something he doesn't like or something he got taken away, or whatever it is. But it's not unreasonable that a kid is throwing a temper tantrum when the limbic system is locked up and he doesn't know what to do with the overflowing emotion. Okay? This is what happens when a person is experiencing PTSD. The limbic system gets locked up and there is overwhelming production of cortisol, the stress hormone, and so the person is literally locked up. Okay? Mental illness is something that people really kind of doubt, and they don't, sometimes they'll even say, that's, you're just crazy, you're making it up, because they can't see it. I mean, obviously you can't open up the brain and see emotions, right? So that's one of the dangers of mental illnesses, is because people don't believe what they can't see. But mental illnesses are very, very serious. And so when I'm doing these talks, I want to make sure that everybody understands, if you're experiencing any of this, it is absolutely nothing to be embarrassed by. It is nothing to be ashamed of. But it is something that you need to try to be responsible for and really take care of yourself, because it is serious. And if it's not taken care of, and if there's not an intervention with some help, then it only gets worse. Imagine your brain being locked up, and if it doesn't know how to unlock itself, like when a child is able to say, yeah, okay, I'm okay, I'm okay. When a child is throwing a temper tantrum and then you're able to sort of guide him with, okay, so you must be upset because your toy's broken, right? Yeah? Okay, your toy is really important to you, and so maybe we can fix it up. Do you think? Yeah? Okay, so if we put the toy together, are you going to be happy? Yeah? Okay, you're not crying anymore, right? That's when you know that the limbic system is not locked up anymore, it's now functioning, okay? We have to help people with PTSD syndrome to unlock the limbic system so that it can function that way. And it's totally possible. There are hundreds of psychologists and therapists who are trained to help people in this way. So I really want to encourage you to let somebody know you have friends for this reason. Let your leaders know, let your parents know, because there is help. Okay? Let me see. Okay, so let me talk a little bit about something that you might be able to relate to, and just ask yourself, does this contribute, to any of my depressive symptoms or anxiety? It doesn't even have to be anxiety disorder. It can be any, we can experience anxiety or depression depending on something called temporary stress. We all have temporary stresses every single day, right? Those temporary stresses, if they're not managed, it adds up, or they add up, right? So, and we don't want it to get that way, and we want to make sure that it gets balanced out and it gets managed before it gets too big. But we all experience temporary stresses that can cause temporary depression or temporary anxiety, okay? So if you've experienced anything temporary in that way, you can also ask yourself, I wonder if this has anything to do with my temporary anxiety or depression or something more chronic. Okay? So the immigration experience, we have something called adjustment disorder. I don't know how many of you immigrated at a younger age? How many immigrated at an older age? Okay, younger means younger than 12. Okay. Okay. How many immigrated over 12, after 12? Not many. How many of you were born here? Okay, most of you. Okay, great. So then maybe the acculturation disorder that pertains to the actual immigration experience of changing cultures doesn't necessarily apply. But I think when it comes to identity, the cultural identity, you might be able to relate to it a little bit more. Okay. So, in your experience of attending your schools and living in this American society, have you ever wondered about your appearance? Have you ever wondered, my appearance as an Asian, am I beautiful? Am I handsome? Do I fit in or not? Okay. There are people whose depression is very severe because of their appearance issues, because they just cannot find that acceptance in the culture that they live in for the way they look. Okay. I mean, we have history full of people being discriminated because of their appearance, right? But ask yourself, okay, how much of my own appearance or how much of my own perception of my appearance in this American culture, even when you are among other, Korean Americans, how much of that do I think contributes to my sense of depression? Because you don't think you are quite good enough when it comes to looks, okay? Lack of English fluency. When a lot of people, when they immigrate to America at an older age, obviously there's going to be an accent and there's going to be the language confusion, okay? Because of their lack of English proficiency, sometimes their self-esteem and self-confidence can be really minimized, which obviously will contribute to something called, will contribute to depression, okay? Lack of support from parents and family. Your survey that you have, studies have been done for the last 35 years that I have been following that basically ask the question of how does parents' relationship to their children, especially in intercultural families, how does those relationships contribute to depression? And so study after study after study after studies have shown that, yes, parents' relationship to their children directly correlates to the level of depression among especially bicultural kids, kind of like you who are Korean Americans. And more studies have shown that Korean American kids, whether they were born here or they immigrated here, they suffer, they're always either number one or two. They suffer the most. In comparison to other cultures, they suffer from depression, largely because of the parents and the children relationship. And after you take this survey, I'm really curious. I would love to hear what you found, what you discover for yourself. But study after studies have shown that Korean American kids who are very acculturated in America, they experience higher level of depression compared to other bicultural kids, largely because of this one particular factor, which is the parents' relationship to their kids. Okay? Is anybody offended? Do you doubt it? Does that sound unreasonable? Okay. Okay. Ethnic self-identity, there's a lot of racism and prejudice, obviously. I don't know if you have experienced anything like that or you have seen a loved one experience any kind of racism or prejudice. This, too, will contribute greatly to your level of depression because then it instills something called powerlessness in a person, where when you feel like you are really discriminated against and there is nothing you can do about it and you are powerless to fight back, then obviously that's going to make a person very depressed. Okay? Becoming American and maintaining Korean identity, trying to figure out, well, how much of me is American and how much of me is Korean, it's a lifelong question. It's something that you have to try to balance almost every single day of your life. So just always be in this mindset of, okay, where am I today and how am I different from other Americans because I'm Korean? How am I different from other Koreans because I'm more Americanized? This can be kind of depressing, especially when you feel like it's just such a constant struggle and constant question that doesn't have much of an answer, okay? Family expectation, that's highly based on the Confucianism. Confucianism is a philosophy that's very, very prevalent. I mean, it's like the basic makeup of the Asian culture. It's really dependent on the beliefs in hierarchy. There's a lot of hierarchy, and there's a hierarchy with everything. So in this case, there is a hierarchy depending on age. You know, in Korean culture, everybody needs to know how old everybody is because they need to know where they stand. You know, when you're sitting next to somebody who's older, then you already know like what kind of relationship you're supposed to have with them, right? That's Confucianism, okay? Also social class, you know, what school do they go to? What neighborhood do they live? And this is just in Korea. Even in America, that's a factor, right? That really kind of determines where you stand in the pecking order of social norms. And you know who you can have a relationship with and who you cannot have a relationship with, okay? This is really difficult, especially when you have parents who instill this hierarchy at home, because obviously out in the American society, it doesn't work that way. It doesn't matter it doesn't matter how old you are. We're supposed to treat each other all equally, right? But sometimes it's the difference is so black and white that it's really difficult to know how to balance it, okay? Social expectation. You've heard of the term model minority. Okay, it's a terminology that's become much more popular, especially among Asian Americans in the workforce. Okay, so there's an expectation for a lot of Asian American workers to perform, to stay at work later, to obey, to never complain, right? And by doing so, you become something called model minority. Yet there is such glass ceiling for model minorities. There is lack of promotion, for an example. You can only go so far because you don't know how to fight the system. You don't know how to challenge it because you are so focused on being the model minority and being who your boss wants you to be, okay? This can be really depressing. Why? Because majority of Asian Americans, let me just focus it with Korean Americans, we spend most of our lives being educated. If you don't have a master's degree, you're just not quite, you haven't quite arrived, right? You got to go for a higher degree. So we're always studying, we're always going to school, we're always trying to get the next degree so that we can have a job where we can be a better model minority, right? But we're never taught how to fight the system and how to really stand up for ourselves so that when we get demoted or not promoted, we don't know how to fight it. We keep our mouth shut, right? But that's considered model minority. That's what you're supposed to do. The result is very negative. A lot of people become very depressed and even suicidal, which is understandable considering how much money and time and effort and how challenging it was to get through the school system and the tremendous pressure and the stress there is. Yet you can't use it. You can't go anywhere. You can only go so far in a company because you don't know how to fight it. Does it make sense? So this can also be a big contributing factor to depression, especially among Asian Americans and Korean Americans. Okay. There's a lot of shame and self-minimization that comes because of our Confucius beliefs, you know, in the Korean culture, where everybody else is more important, but you are not. Okay, you have to make sure that everybody else has, you know, whatever they need before, and then you're the last one in line. So there is always this self-minimization of always considering the good of the collective group to be more, to be of a higher priority than your own needs. And I'm going to tell you right now, if you don't have your own personal needs met first, there is no way you can have anything good happening in the collective group. So in reality, it's actually the other way, where you have to be satisfied as a person. You have to know you have to be happy, and you have to feel a higher level of satisfaction before you can have something to give back to the group. But based on the Confucius philosophy, it actually is promoted the other way, where you have to make sure that the group is happy, and then, regardless of how happy you are. And it doesn't work that way. So we have a lot of people walking around always thinking that they have to make the group happy, but they're so unhappy because they're not satisfied. They feel completely empty, okay? It's a direct correlation to any level of depression. Any questions so far? Does this resonate with anybody? Am I talking about somebody else? Because it has to resonate with you. You have to be able to relate to it to find some value and purpose to this talk. If you're not able to do that, then please, stop me and say you need to talk about something else. Okay. All right. So some of the PTSD symptoms that you can be aware of. These are three primary symptoms that I look for as a clinician when somebody tells me that they've just come back from the war. Okay. So the first one is re-experiencing symptoms. The second one is avoidance symptom, and the third one is hyperarousal symptom. And I'll just read really quickly what this guy said. He said PTSD symptoms may include difficulty falling or staying asleep due to recurring nightmares, reliving the traumatic event, hypervigilance, and easily startled. Okay? Anybody who has PTSD absolutely has all of these symptoms. Have you ever gone 3 nights with no sleep? It's pretty miserable. Absolutely miserable. You feel like you're going to crack. People who experience PTSD symptoms, that's the way they feel. They feel like they're going to crack and fall apart because they can't sleep. Okay? And it's not insomnia. It's literally they cannot sleep because of fear. Okay? So re-experiencing symptom, what does that look like? Flashbacks, which is something called reliving the trauma over and over, including physical symptoms like a racing heart and sweating. Okay? People are likely to have really bad nightmares, which is why they don't want to go to sleep. And there's always pending fear of something's going to happen. So they're kind of always in a constant state of hyperarousal, of being alert, which is exhausting after a very short while. Okay, the next one is avoidance symptoms. This is sort of kind of countering the first one. It's staying away from places, events, or objects that are reminders of the experience, feeling emotionally numb, feeling strong guilt or depression or worry constantly. We're talking on a daily basis. Okay? Losing interest in activities that were enjoyable in the past, and then having trouble remembering the dangerous event. Okay? So when I have talked to people who are experiencing PTSD symptoms and I ask them about various events that might have been the trauma, they remember it in bits and pieces, but they don't remember exactly what happened. But that's the way there's a part of the brain that is actually protecting them by remembering only bits and pieces and not the whole thing, because to remember the whole thing is too traumatic. Okay? The third one is hyperarousal symptoms. They're very easily startled. For example, you can just be sitting there and just kind of scoot over to sit next to a person who's actually experiencing PTSD symptoms. They'll start screaming because they're so easily startled. Okay? Feeling tense or on edge, having difficulty sleeping, and or having angry outbursts. Okay? So a person is diagnosed with PTSD when this has been enduring for at least 1 month. They're experiencing at least one re-experiencing symptom, or 3 avoidance symptom, or 2 hyperarousal symptom. Okay? If I detect any of this in a person's narrative of what their experience is, then PTSD is a diagnosis that is provided, and then we provide a lot of different therapy treatments that will specifically address that. Okay. Some of the treatments, as I talked about, I'm going to kind of be talking about similar treatments. I'm going to skip this one for now. Depression. Let me kind of go through depression real quick, and then I'm going to break you up into small groups, okay? So there are various different types of depression. Depression is not just one thing. So there's something called major depression, and this is sort of when it gets at its worst without having dealt with those small temporary stressors, okay? As I said before, everybody has, how many of you just finished your final? How many of you are really stressed taking your final? Nobody? Okay. Imagine being in that constant state of stress for a very prolonged period of time. Okay? It's not good for a person. Okay? You can pull one or two all-nighters and then get through it, and then your life as whatever your normal life looks like, it can continue on, and then that's fine. But if you're in the constant mode of stress, then something's going to break down. You're going to break down in some way. Okay? So this is when major depression happens, when there was really no help or intervention to help with your temporary stressors. Okay? So these are very severe symptoms that interfere with your ability to work, sleep, study, eat, and enjoy life for at least 2 weeks or more. Okay? So when you've experienced this lack of interest in life for at least two or more weeks, then there's a good there's a good probability that you're experiencing something called major depression. Okay? Psychotic depression, these are much more severe, obviously. This is when somebody has been so depressed for so long that now they're having psychotic symptoms like being able, seeing things that are not there or hearing things that are not there. Okay? Postpartum depression, this is what we call baby blues. It happens to a lot of women, particularly after having the first child. Okay? Because it's such a shock to the woman's body to stay pregnant for 10 months, deliver a child. You have so many different chemical changes in the body. A lot of times after the first child, a woman goes into something called postpartum depression. And this is really serious, as all depressions are. It's very serious because there certainly has been women who have killed the baby and themselves because the postpartum depression was not treated. Okay? So again, something to really be mindful of, especially if you're a woman and if you plan to have a baby. This can happen to anybody. And there's really no way to tell if it's going to be you or me, because you have to actually get pregnant to see how your body responds and what happens to you chemically. And then you can know, oh, I think I have postpartum. Some women, they don't have postpartum. Okay? It kind of depends on the person. Seasonal affective disorder, this almost never happens in San Diego. It usually happens, which is a very good thing because we are so lucky to live here, but usually happens in places where there's prolonged winter time. So for an example, like Washington State, they have a heightened rate of suicide, especially during winter time, because people lack sunlight. And when a person lacks sunlight, it induces depression in the brain, and that without help and without intervention, it can oftentimes cause end in suicide. So we want to kind of, if you feel like, or if you know somebody who tends to experience seasonal depressions because they do live, let's say, in the East Coast or somewhere that are actually, there are 4 seasons, but the winter tends to be longer, then you can talk to them about maybe just even getting some natural artificial sunlights through different lamps and things like that. There are companies now who only focus on making lamps to produce natural lights to decrease symptoms of seasonal affective disorder so people don't commit suicide. It's that serious where there are actually now companies who are really focusing on this as a way to keep people from dying in such an unfortunate way. Bipolar disorder, this is what we call cycling of mania and depression. What happens is we have people who have bipolar disorder tends to have very, very very high highs and then very low lows. And this can happen on a daily basis or even hourly basis or on a weekly basis. People who are really going through something called what we call an episode, bipolar episode, every hour their mood changes. So 1 hour they can feel like, hey, the world is mine. I'm gonna go and do whatever I want to do, and they feel extreme surge of energy, and they can do amazing things. I mean, I've known people who learned an entire language over 6 months period of time because they didn't sleep, because they had such surge of energy. Okay, but what happens is they inevitably have a crash when they become extremely depressed. Okay, so anytime a person has this cycle of high highs and low lows, we have to make sure that the person is helped, either medically or through therapy, because this is not normal. This exhausts a person so quickly that oftentimes they commit suicide because they can't take the constant change, just in their moods. Okay. So, some of the signs and symptoms of depression: persistent sadness, anxiety, or feelings of just the emptiness. Okay. Feelings of hopelessness or pessimism, nothing's ever going to work out anyway. Feelings of guilt, worthlessness, or helplessness. If you're feeling helpless, please make sure you talk to somebody, because there's always help. You just have to reach out. Okay? If you're anytime a person is feeling worthless and feeling like I'm the only one, or feeling very isolated, that's the first indication that you need to go talk to somebody. Irritability or restlessness, when you just feel like you get angry very easily and you snap at people, you yell at people even though you don't want to do that. Loss of interest in activities or hobbies that you really liked before. Fatigue and decreased energy, you just don't feel any energy to do anything. So a lot of times people who are experiencing major depressions, for example, they'll stay in bed all day, and they just can't pull themselves out of bed. Okay. Difficulty concentrating, remembering details, and making decisions. When you're exhausted, when you haven't slept, you're not going to remember anything. Okay. Insomnia and early morning wakefulness or excessive sleeping. A lot of people who, when they are experiencing major depression, they sleep a lot because they're so exhausted. Okay. Overeating or appetite loss. Just however, some people really overeat and gain a lot of weight, which in turn is very depressing. Other people who lose a lot of weight, which in turn is also depressing. Okay. Thoughts of suicide and suicide attempt. A lot of men will experience a lot of pains and aches in their lower backs as a result of severe unmanaged stress that can lead to depression. So if you're a man and if you're experiencing a lot of aches and pains in your back, particularly the lower back, please be careful with yourselves and also use that as a signal, as a sign that something needs to change. Okay? For a lot of women, the upper back, you can throw out your upper back, especially along your spinal column. This is the way the body is basically saying, hey, you need to change something because you're overly stressed. Because if you don't manage it, then you are going to get depressed. And then the problem becomes much harder to manage, although it's totally possible to do so. So I just want to kind of read this out loud to you. I know you can read it yourself. But this is kind of what depression can feel like. And this is why it's very serious. It is not an invisible illness that will just go away. It's a very serious internalized and personalized illness that stays with you. And then, again, it only gets worse if you don't get some help for it, okay? So somebody who was suffering from a very serious major depression said this: I brushed my hair today. For the first time in 4 weeks, it was matted and twisted together. It snapped and tore with every stroke. I cried while I washed and conditioned it because I forgot how it felt to run my fingers through it. I brushed my teeth, too, for the first time in a week. My gums bled. My water ran red. I cried over that as well. When I got out of the shower, I couldn't stop sniffling my hair and my arms. I've avoided hugging people for a while because I never smell good. I always smell like I've been on bed rest for a week. I have no clean clothes because I am too tired and sad to wash them. Depression isn't beautiful. Depression is bad hygiene, dirty dishes, and a sore body from sleeping too much. Depression is having 3 friends that are only still around because they have the patience and love of a saint. Depression is crying until there is no more tears, just dry heaving and sobbing until you're gasping for your next breath. Depression is staring at the ceiling until your eyes burn because you forget to blink. Depression is making your family cry because they think you don't love them anymore when you're distant and distracted. Depression is somatic as well as emotional, an emptiness you can physically feel. Please be easy on your friends and family that have trouble getting up, the energy to clean, hang out, or take care of themselves. And please, please take them seriously if they talk to you about it. We're trying. I swear we're trying. See, I brushed my hair today. Okay? So depression is it's not a fleeting mental illness. It's not something that, it'll go away, just stop thinking about it or to go do something else. It's really debilitating, okay? So if you yourself have experienced some symptoms of depression or know somebody else who's talking to you maybe, or you're witnessing or you're observing that they're experiencing something like this, get some help for them. Get some help for yourself. Nobody will want to live like this, okay? And they don't have to. Okay. So real quickly, I can't talk about depression without talking about suicide, okay? Because depression gone untreated almost always ends in suicide, which we want to try to prevent because there's a life to be lived. You were born to live a life, right? So in order to do so, we want to make sure that people are very aware of these symptoms of depression so that they can be helped, so they can move forward and live their lives, okay? So suicide claims more lives than war, murder, and natural disasters combined. That's a lot of deaths, okay? And it's really unfortunate because if they could just talk, if they could have just reached out, or if somebody could have noticed and said, hey, can I help you? It could have made a big difference. But what happens oftentimes when a person seems really dark, they seem like they just want to sit by themselves and, kind of send out the vibe and energy of, I don't want to talk to anybody, don't come here, then people don't come there. People don't reach out. And so that consistent and constant state of isolation is going to lead to depression. And unfortunately, if nobody reaches out, that can also end in suicide, okay? Because the conclusion that's made is, well, nobody cares anyway. So over 50% of all people who die by suicide suffer from major depression. That's over 50%. Remember, suicide happens more than natural disasters. That's a lot, right? I mean, we live in San Diego, so you might not, well, what natural disaster? But there's a lot of natural disaster that happens in the United States all the time. A lot of floods, or, hurricanes, tornadoes, things like it. It happens a lot. So to think that suicide happens even more is pretty astounding, especially when there is something we can do about it to prevent it. But when you add alcohol to a person who's already depressed, the stats jump up to 75%. That's 25% more the possibility of suicide for a person who's already depressed. When you add alcohol to it, alcohol is a depressant, right? It doesn't energize anybody. If you drink alcohol, especially if you overdrink, it's going to make you depressed. It's going to make you immobile. It's going to make you black out, okay? And when this happens, the thoughts of suicide and the thoughts of, I'm not doing anything anyway, I'm not doing anything good anyway, happens a lot more, and a person is much more likely to commit suicide. So anybody who's experiencing depression, I always ask them about what is your alcohol usage like, okay? Because there's a direct correlation, and we have to make sure that the alcohol is not consumed. If the total abstinence can be attained, great. But even if the person drinks, we want to make sure that it's managed. Have 1 beer a day, okay? If that's good for you. Okay, let's try to manage that. Don't jump up to 2. Don't jump up to 3. Okay. Have somebody there with you to kind of monitor you to make sure that you only drink 1, and make sure that you don't jump up to 2, for an example. Okay. Any questions about this? Okay. Depression is among the most treatable. I'm sorry, let me read this real quick. More Americans suffer from depression than coronary heart disease, cancer, and HIV. Okay? So depression is pretty prevalent. Almost anybody who's lived a life have experienced depression. Thankfully, the ones who are here, you've gotten some help. There's somebody that you trusted, that you talked to, and you did something to change your lifestyle so that your depression was managed. But almost anybody who lives a life experiences depression. Okay, and there is help because depression has been shown to be the most treatable psychiatric illnesses. And we have a lot of different psychiatric illnesses. So if there is an illness like depression that stands out as this is the most preventable, this is the most treatable, then that's a pretty good sign, okay, that there is help. Has anybody heard about the Out of the Darkness walk? Anyone? Yeah? One? Okay. So in San Diego, we have an organization called Out of the Darkness Walk. And they basically, once a year, or sometimes even twice, we most recently had it at the end of March, and all night, people get together and walk. So people who participate in these marches, and I can't remember how many people participated this year, but I mean, it's usually up to, like in the 20, 30,000s, because that many people have known somebody that they loved who committed suicide. Okay, so all of these survivors of suicide get together, and to honor the deaths of loved ones who died of suicide, they walk all night from the sunset to sunrise. And then at sunrise, they have kind of like a meeting where people pray or sing songs or something to commemorate the event, and then they go home. So it usually goes between like 6 p.m. to 6 a.m. Okay? But it's been astounding since this walk has started how many people have come out, more and more. Every single year, the group has gotten bigger and bigger. Because for a very long time, especially in our society, suicide was such taboo. If you were having suicidal ideas or suicidal ideations, you didn't talk to anybody about it because you were considered crazy. You were considered really abnormal. If you had anybody in your family who committed suicide, it must be because you did something, or your ancestors did something. So there was a tremendous shame on knowing anybody who committed suicide or being somebody who had those thoughts of suicide. So nobody ever talked about it. So nobody really knew how serious this was until this walk started, and then people were shocked at how many people actually came out. And this, as I said before, the group of people who are walking and participating, every year it's more and more people. Not because more and more people are committing suicide, but because more and more people are coming out saying, yes, I know somebody who committed suicide. And it's okay to talk about it. There's no shame in it. So what do I do if, the obvious question is, so what do you do? Please go get some help, from a professional like myself. Or San Diego is flooded with psychologists, psychiatrists, and therapists. So there's always somebody on every block who has been professionally trained to help. So please reach out and get some help. Try to be active and exercise and participate in enjoyable activities as much as possible. I have clients who have major depression. I tell them, go rent a funny movie. Just any movie that makes you laugh, go rent. Because just even that activity of watching something funny and even finding yourself laughing, even though you don't really feel like laughing, it changes the brain chemistry so that it regulates and it manages the amount of cortisol that you're carrying around in the brain. Okay? So please try to, and you're not going to feel like it if you're experiencing depression, so you kind of need some support. You're going to need some people who will surround you to say, hey, let's go and do something. Okay? Set realistic goals for yourself. you're not going to be able to just, get out of bed and then get on with your day. So set some realistic goal for yourself. If you can get up by 9 a.m. instead of 6 a.m. like you used to, that's an accomplishment. Okay? And please don't ridicule yourself. Do not criticize yourself because you're not getting up at 6 a.m. Because again, that's the worst thing you can do, because then that creates more production of cortisol, which is going to make you more depressed. Okay? Please don't isolate yourself. Don't be alone when you're feeling down. Call a friend. Talk to somebody. Go to a movie. Try to go take a walk on the beach. Do something so that you can produce some feel-good hormones to counterbalance the cortisol. Okay? Don't expect your mood to all of a sudden get better. It takes a lot of time because there's an actual chemical imbalance in the brain that needs to get regulated. So please be patient with yourself. Please postpone important decisions. Don't get married when you're depressed. Okay? Don't go on dates. Anything that you think will fix the depression, don't do them, because they'll come back and bite you. They really will. Okay? So any serious, important decisions you have, kind of leave it at bay for about 3 to 6 months. Don't make those decisions. Remember that positive thinking will replace the negative thinking as your depression responds to treatment. Okay? But this always takes some time, so please be patient with yourself. And then always be aware that there is something called depression. People experience it every single day, and it is serious. So be sensitive to yourself. Be very, very self-aware that if at any point you're experiencing any of these symptoms, you're able to ask for help early and get some help early and get treatment early, which is so much easier to deal with than waiting. Because like any illness, if you wait, it's just going to take that much longer to recover from. All right. Basically, the treatment, as I said, as I talked about with PTSD, is very similar. So we have something called talk therapy, where you sit down with a person like me, where you talk about, I ask you some questions so that you actually start thinking about, okay, how do I feel about that? Or what have I been through? Or what did that look like? And what did I do about it? Okay. There's also called mindfulness and emotional regulation. And this has a lot to do with literally kind of turning your mind's eye inward to look at yourself, so that you increase your self-awareness, so that you know what's going on with you. Have you ever asked somebody, hey, how's your day going, or how are you doing? Okay. Well, what does that mean? I don't know, it's fine, it's okay. Well, what did you do today? What happened? I don't remember. Okay? Each day goes by like this. Time flies so fast, right? And we can totally just kind of go with that speed and not even think about, what did I do today? Like, how was I impacted? And how was I changed because of what happened today? It's really something, it's important to consider. And always try to connect back to yourself and ask yourself, what happened today? Okay? When the level of depression is really too severe, and the brain chemistry has been out of balance for a very prolonged period of time, then we do have to seek medical help, and at which point psychiatrists' help are sought out. And there's a lot of different antidepressants that a person can benefit from. There are side effects, so we have to make sure that a person is able to take the antidepressant and manage the side effect at the same time, because if the side effect is too severe, then that's only going to make the depression worse. Okay? So my job as a psychologist and also a therapist, my job is to do everything that I can with a person in the natural way, so that you don't have to take medication. But if a medication is really necessary, then I will definitely work with a psychiatrist to help in you managing your antidepressant as you take them. Okay? All right, so what I'm going to do is I'm going to stop here. Everybody has a designated small group. Okay, so I'll ask Simon to come up and sort of direct you.